here today with our patient, Mr. Volker. You've been experiencing some back pain for quite some time now. Just tell us a little bit about your history and what you're experiencing and some of the treatments that you had.
Yeah, so the pain started probably about, I was blown up when I was in Fallujah. So I've had the chronic back problems ever since then. It's gotten progressively worse over the years. So the things I've done is I've had an injection, I believe it was a cortisone steroid of some type that said it was going to block the pain. So I had the injections done there. Seeing multiple chiropractors for relief, and every time I go to the chiropractor, they do the same thing. It doesn't feel like it's a chiropractor treatment that's catered towards me. It feels like a chiropractor treatment that's checking the boxes. I've done the heat therapy, I've done the hanging, the stretching, the all that stuff, and I just haven't had the relief that I'm looking for. So it's affecting my job. I have to run, I have to do all that stuff, and it's drastically affecting my performance at work.
Okay. So we've gone through an examination. We just took some x-rays. It does look like he has a disc injury in your lower back. These type of injuries can be chronic. Unfortunately, the discs, they have a hard time getting proper blood supply. So a lot of times you have an injury to the disc, you'll slip a disc, herniate a disc, and it'll be like an ongoing chronic nagging pain that people deal with for years and years. Sometimes you can end up having to get surgery. But essentially, we can even see some signs of that on an x-ray. Now, this is not an MRI where we can actually see the disc, but we can see general spacing decreases in the spine. So I did some measurements here. Your L5 disc, okay, 2.43 millimeters. And we look up here at L3, L4, 9.74 millimeters. That's a big difference. You know, about 4 times as much space at 2 disc spaces right above that. L4, L5, 7.98, okay, decrease, but not as bad here. Then we also see like some signs of an old injury, right? The disc has, the vertebrae has like gone back a little bit. It's called retrolisthesis. You get that in like a hard fall, you get that in some type of sports injury. Older patients get it too, as the facet joints here and the pars degenerate over time. They get a little more brittle and wear out. But you can see some evidence of an injury here as well. These are little holes that the nerves run out of here. So we're looking at your back from the side, okay? You can see you've got good spacing here, good spacing here. You can see the open spacing. If you see down here, it almost looks the same as the bone, and you're likely getting some compression on some of the nerves down there as well, and that can be a pain-generating source as well. You know, pain around the upper thigh, the back of the leg, pain around kind of where the nerves run out of the back. So what I'd like to start you on, if you don't mind, is some muscle stimulation with this table that we use to kind of open up the spacing here. See if we can pump and decompress the lower lumbar spine and get some of the compression down in your lower back. Then I'll come in afterwards. We're going to do the Y strap and a chiropractic adjustment on you as well.
Awesome.
All right, can you lay face down here? And let me just grab my assistant. I'll be right back.
All right. I feel it stretching. I feel it working.
Okay. Slide up just a little bit.
Like there, it just popped.
Yeah.
Okay. I think that's good, right? Wow, that's crazy.
Yeah, we're gonna get. Does one side hurt more than the other, or is it
Probably the right side.
the right side?
Yeah. This is wild.
Yeah, we're gonna get L5, and then where, like here or here? What hurts more, here or here?
Up. Both about the same. But
Okay.
I'm probably above. Yeah. Probably above more.
Let's get L4 and L5. Okay. All right, just gonna start you on this, and I'll see you here in just a couple minutes.
Great. Thank you.
This person stopping contact.
Yeah, this is wild.
Have you had the stem machine done before?
No.
Okay, so the stem machine we use to help block pain as well as relax the muscle tension is gonna be like little tickles. It's not supposed to hurt, but if you do feel like it's
Oh,
pinching.
yes. I'm sorry.
You
I
had it
thought
done?
Yes.
Okay.
Hot pad cream almost.
Mm-hmm.
That's great.
Feels really nice. Just let me know if it gets too hot.
No,
Okay?
that's great. Thank you.
How does it feel?
Great.
Feels great?
Feels like you're rubbing a cream on it. Yeah, I'm getting a little massage, yet feels great.
Feels great?
Yeah, it
Good.
feels great. Now I'm starting to feel the heat a little bit.
You starting to feel the heat? Okay.
Yeah, just a little bit. But it feels good.
Okay. Remember, just let me know if it starts to get a little too hot.
Okay.
Go in and adjust your spine. Are you okay with that?
Yes. Yes, please.
And you're having some neck pain also?
Yes. Oh.
Good. Release some pressure. And let's see, now have it lay on your back here, face up. And for the Y strap, we're gonna have you slide down, come down on the table.
Okay.
Keep going.
Oh, yes.
Keep going here. All right. Now, sometimes it's the first time it gets all the way down to lower back. Sometimes it's just the neck and upper back. But let's give this a try.
I'll take whatever I can get.
You can take a couple treatments to break through the stiffness.
All right.
Lean back.
Okay.
And all you have to do, just hold yourself in, push your legs down. Don't let me pull out.
Oh.
Did you feel it all the way down your back?
Yeah, it felt great.
Great.
Wow. I felt much better.
Let me do a couple other things with your back here. Let's see, can you sit up, face the wall?
Okay.
Slide back on the table. Keep coming back. Yep.
Okay.
There. Come around here.
What type of symptoms may be experienced from bulging disc?
Let's go all the way back. And now can you lay on your side here facing me?
Upper lumbar bulging disc may cause pain to radiate in the lumbar area.
Across here.
Bulging disc in the lower cervical
There, I saw that.
radiation of the arm. A bulging disc in the mid-cervical may cause
Your shoulders relaxed. Oh, good. Lay on the other side here.
Great.
acute pain may not be the only symptoms caused by a bulging disc. Lower lumbar bulging disc may cause painful symptoms.
That's good. Ooh, wow. Let's see, let's come on up.
That was great.
How'd all that feel?
Oh, I feel so much better.
Okay.
Oh man,
Great.
I
You
feel
can
so
definitely
much
feel a lot of the tightness, compression,
better.
inflammation in the spine.
I feel so much better. I don't even know what to say. I feel so.